Hey everybody, I hope this finds you well. This is a presentation coming from the University of Texas, Arlington, Masters in Science of Nursing, Nursing 5319. This is in partial fulfillment of the pharmacologic class, and the instructor is Dr. Linda Grande and Coach Jody Bowling. So appreciation to them. This has been a really good class. I would like to discuss with you guys my pharmacologic education plan. Since we're in education, we have to consider the different learning styles. This is a VARC model, which includes visual, auditory, reading, and kinesthetic. And we all have a combination of these different types of learning. So just briefly discussing different types of centered learning, student versus teacher-centered. So in student-centered learning, it's more of an adult learner. The student chooses what, when, and where learning occurs. They have lifelong learning. The teacher acts as a navigator. In the teacher-centered learning model, to me, I think more of an traditional type of education, such as in the elementary and junior high school system, where the teacher or the agency is pushing out the information to a student who is a passive learner. So as educators, if we're going to present a topic, we have to have a guidance, and that is our learning objectives. So again, thank you, Benjamin Bloom, for his learning objectives and letting us state and clearly present verbs for learning so that we can evaluate our students on the amount, the quality and quantity of education they've retained from our information that we've presented to them. So this being our class on pharmacology, I wanted to discuss something on either chemicals or drugs, and the bulk of what we do and what we teach and what we prescribe in pharmacology is drugs to treat. However, there is an entire other group of medications, chemical substances that are out there that are actually preventative. Okay, so we all engage in preventative medicine. We don't smoke, we have a good diet, we try to exercise when we can. So this is in specifically addressing prenatally. So my mantra here is an ounce of prevention with folic acid is worth 100 pounds of cure. Because if you take adequate folic acid, the studies show, the research is out there, worldwide actually, that shows that you can actually prevent or decrease your chances of having a baby with either a neural tube defect, a midline defect. So what am I talking about midline? Either when the neural tube is forming between days 0 to 27 of conception, what you have is the central or the one on the back where the tube forms and comes together. If you don't have that cell network laid down in the proper manner, then from there on you can have a defect. So if you take folic acid, it actually, and they've done this embryologically with mouse models, and it actually makes the cells line up in the proper way so that the normal matrix is there. So it decreases your chances of having a baby with these defects. So to me, that's huge. So this is, again, it's not fancy. It's actually research. It's been proven. So I have a video. If the video doesn't work, I'll leave a link for you so that you can access this video as well. So folic acid is readily available. It's very affordable. You can buy it over the counter. Your body does not make folic acid. It has to be supplemented. So if you don't have an adequate diet or even if you do, there's new recommendations out by many different agencies so that you can get adequate folic acid 1 to 3 months preconception, and then during at least your first trimester of your pregnancy. Slide is discussing, it's from the CDC, it's discussing the prevalence of neural tube defects, and you can see there, worldwide, US, Canada, Chile, per rate per 10,000 births. So it's pre and post folic acid administration. So you can see the numbers there yourself. In Chile, down 50% of neural tube defects just by taking folic acid fortification pre-pregnancy, preconceptually, and during the first trimester. So why do we care about this? Okay, so neural tube defects worldwide cause about 300,000 cases of deformation per year. They are one of the most common congenital deformations. They're a leading cause of morbidity and mortality. If you've ever known or heard of any baby that has had a spina bifida, they're in a wheelchair, or there's a whole spectrum, of course, to anencephaly, where the baby is completely not a viable baby, then you can understand that this is a huge and important topic. It's a global initiative. Folic acid is on the World Health Organization's list of essential medications. And the key thing here is it's preventable. Preventable. We're not treating, we're preventing. So here's some interesting fun facts on pharmacodynamics and pharmacokinetics about folic acid. And it is, you have to have an exogenous form, which is a supplement. So you have to take it. Your body doesn't produce it. It stimulates production of red blood cells, white blood cells, and platelets. It's also used to treat megaloblastic anemias, and it is absorbed completely, even if you have a malabsorption syndrome. Another thing is it's absorbed rapidly from GI, from the proximal intestine primarily, and it's actively concentrated in the CSF, which is interesting because it can prevent the neural tube defect. So it's interesting that it's concentrated there to me. It's excreted unchanged in the urine, and it's metabolized by the liver. So again, this is a worldwide initiative. Different agencies have different recommendations for folic acid, and you have to consult with the individual agency. The ACOG here in America recommends 4 milligrams per day. Now there's different recommendations for high risk and normal pregnancies. The normal folic acid recommendation is 400 micrograms. But if you're considered high risk, if you've had a baby with a previous neural tube defect, or even if you just want prevention, because there's really no side effects to this dose of folic acid. Unless you take mega doses, you are not really going to have any type of side effects or other complications. It's a B vitamin, it's water soluble, and it's excreted. This is a case scenario I'm going to hand out to you guys to work on in group and individually. But Mrs. Pale is planning on becoming pregnant soon. Her previous pregnancy was resulted in a stillborn infant with a neural tube defect. This makes her considered high risk. So she's in the high risk group. You have to check the algorithm. But again, the normal intake of folic acid recommendation would be between 400 and 800 mics per day. However, since she's in the high risk group, we're going to recommend that she takes 4 to 5 milligrams per day during the first 1 to 3 months prior to conception and the first trimester. This is a handout for you and for your patients on frequently asked questions about folic acid. My references. Thank you so much for attending and participating this quick module on folic acid. And I hope your week is amazing. And here's a quick quote from Benjamin Franklin. Tell me and I forget. Teach me and I remember. Involve me and I learn. All right. Have a great week, guys.